Hey guys, my name is Rene and I am a veterinarian of 15 years that specializes in small animals and exotics, and I go on TikTok every night at 8 p.m. Central to answer questions about the veterinary field in general, or if people have questions about their fur babies. And then of course I always do it with the caveat that is for educational purposes only, and that I always tell people they need to talk to their veterinarian for diagnostics and seek out diagnoses. But during my lives every night, I have a lot of people ask me, I feel like I answer the question like 60 plus times in a 2-hour period every night about allergies or itchy pets or itchy dogs, itchy cats. So I figured while I wait in car ride or line, because we've got to be multitaskers as a moms, that I could talk to you guys about allergies to be able to refer people back to this video, so I don't have to talk about it so many different times in a live multiple times. And so allergies are one of the most common things that brings animals into a veterinary office. And so I figured I would talk to you guys about allergies and the different things and the different ways that we could go about treating those. So a lot of the times allergies in dogs and cats are typically due to contact allergies. That means that they're allergic to something in their environment that's causing them to be itchy. It could be something they're inhaling, but usually it's something that's coming in contact with their skin. On the rare occasion, we can have allergies due to food, but it's more so allergic to the protein that's in their food versus the grains that are in their food. They definitely can be allergic to grains, but for the most part, they're allergic to the protein. And the most common proteins that dogs and cats are allergic to in their diet are beef and chicken, just because those are the most commonly used proteins that we use in our dog food or cat food. And so what we need to do is try to figure out first, and gold standard would be to figure out what your pet is allergic to, especially if this is a pet that's gone into the vet multiple times for skin allergies or hair loss or redness, or they're scratching and they're chewing at themselves. So it's always best, if you can, to take your pet to a dermatologist and have them perform the skin prick dermatology testing to figure out exactly what your pet is allergic to. And what they could do from there is tell you what your pet is allergic to, and then they could give you either allergy injections or sublingual drops that you can put under your animal's tongue every day. And then what the goal of that is to give them micro doses of the things that they're allergic to, in the hopes that we desensitize them so they have less reaction to those, so therefore that their allergies will improve. And so that is considered gold standard, and that is what I would typically recommend anybody do if that's an option. But I understand that that is expensive, and not everybody may have a dermatologist available to them. So another alternative is sorry, I gotta move my car for a second, guys. Another option would be a blood test that you can have your general practitioner perform. It's not as reliable. It's not as reliable as the skin prick, but it's an option if that's what you have to do. And so from there, what we could do is do a blood test, find out what your pet's allergic to, and do the exact same thing, the allergy injections or the sublingual drops. If that's not an option, then at that point, all we can do is treat their symptoms for what they're being itchy. And so when an animal has allergies, what is happening is that they're itchy, they're reacting to whatever is making them allergic. They're now licking and chewing or scratching at themselves, which in turn will destroy the skin barrier, and then your skin is no longer healthy, and then the bacteria and the yeast that live on the skin as normal flora now have an opportunity to cause a problem. So now we're getting secondary infections due to things that are on the skin that normally don't cause problems, and you'll never be able to get them to stop itching if we don't address those problems. So a lot of the times your veterinarian will do a tape prep or a skin scrape or a nail fold analysis. Look at that under a microscope, find out exactly what is happening with your dog's skin, what type of infection is present, whether it's bacteria, whether it's yeast, whether it's both, because it definitely could be both. And then we need to treat those. And the ways that we treat those are typically with antibiotics. Sometimes we can do oral antifungals as well. I personally find that a lot of the times we can clear up bacterial infections much faster than we can clear up yeast infections. So typically if I have a systemic yeast infection on a dog, I am going to prescribe an antifungal for a minimum of 30 days. So they're going to take that by mouth. I'm going to treat their bacterial infection on their skin from anywhere from 10 to 21 days depending on how severe the infection is. And then from there, we also need to control their itchiness. So we have to give them something that can control their itchiness. And the best way that I can go about that is with medications like Apoquil, Cytopoint, and Zenrelia. And so the way that those medications work is they actually bind the receptors in your pet's brain for itchiness and inflammation. And a lot of times cats, they're kind of left out on that. Atopica is the option for cats with allergies. But we can sometimes use Apoquil off-label for cats if need be. But so what it does, there's these things called JAK receptors in your pet's brain that basically cause the inflammation and itchiness that your pet has to an allergy. So what these medications do is that they will bind those receptors, therefore your pet doesn't know to react, or their pet's immune system doesn't know to react to the things that they're allergic to as much. And so things like Apoquil and Zenrelia and Cytopoint can greatly improve the overall quality of your pet's life by reducing the amount of itchiness that they have. A lot of people ask me about over-the-counter options in like human antihistamines, and the unfortunate thing is that a lot of human over-the-counter antihistamines like Benadryl and Zyrtec, unfortunately only about 30% of dogs will actually respond to those antihistamines. So for the most part, your pet's going to it's not going to do anything for them. And so it's always worth a while if that's what you need to do. So we can definitely, give doses for those if that's something you want to try, with the understanding that your pet may not respond to them. And so usually what's going to happen is your pet can also have their allergies treated by going to dermatologists. And if that's not an option, then from there, we have to treat their symptoms. But just with the understanding that without having an allergy testing performed and getting on those allergy drops, we're just putting a Band-Aid on what's causing them to be itchy. And sometimes that's the only thing that some people can do, and that's okay. Steroids are options for animals with severe allergies, but those are only usually short term, and most veterinarians don't like to give those. That's the great thing we always say about Apoquil, is that you get the benefits of steroids without the side effect of steroids. And so usually if I have a pet who comes in who has severe allergies, whether it be a dog or a cat, and we definitely talk about their history, things that they've done in the past, if they've seen other vets for it. So exactly get a really good history on them, figure out exactly what they've done in the past, what things have worked, what things haven't worked, and then we formulate a plan together. And a lot of the times we're going to take samples of the skin, see exactly what's happening with the skin, and from there be able to determine what treatment option is best. Other things that are super underrated when it comes to helping with allergies allergies, itchiness, or secondary infections is bathing. Bathing with medicated shampoos can be incredibly helpful for animals who have itchy skin or systemic skin infections. And so I like to use chlorhexidine shampoos. I'm a big fan of mousse, like leave-on mousses that you can put on your pets, especially on yeasty feet. That can be very helpful. And so there is the biggest thing that we can talk about when it comes to allergies is that I can literally talk to you for hours about allergies. But the biggest thing to know is that there's no one fix for everything, and that what works well for one pet may not work well for another. And so you just have to go through a little bit of trial and error to figure out what will work for your pet, and talk to your veterinarian about different treatment options that you have, different testing that can be performed to determine what would be the best course of action for your pet. But the biggest thing that I can reiterate time and time again to pet owners is that no over-the-counter option is really truly going to be beneficial enough to be able to clear your pet up of allergies, and a lot of the times you will need to seek out some type of veterinary intervention. Hope this was helpful. Y'all have a great day.